Welcome to the Dr. Mary Lauder podcast show, where we explore the messy, magical, and deeply human journey of healing. I'm your host, Dr. Mary Lauder, a board-certified osteopathic physician, an accidental shaman, and a lifelong student of human experience. Together, we're going to talk medicine, wellness, and culture in a way that's grounded, perhaps maybe a bit cheeky, but always from the heart. And don't miss Gadgets, Gimmicks, and Gotchas, my reoccurring segment where we lovingly call out the fluff and highlight the stuff that actually works. So grab your favorite brew, coffee, matcha, or that mysteriously green smoothie and settle in. It's time to get this party started with a strong dose of soul medicine. Hi, and welcome to the Dr. Mary Lauder podcast show. I'm so glad that you're here. We have a very important show today. We're talking about you, your DNA, your genomics, and your way through to good health, restoring your health by not guessing. My guest today is Virginia Wood. She is a clinical nutritionist, a holistic nutritionist, a functional medicine nutritionist, and she literally goes around the globe talking about DNA testing, and how important that is to your health. So it's going to be a great conversation. And know that it's not a commercial for a specific company, but she happens to be from a specific company. And the important thing here is that she's on the forefront of reporting, of understanding, and bringing wholeness and goodness to your health by using DNA testing. So, welcome to our conversation. Sit back and enjoy. Well, welcome, Virginia, as my guest here in the Dr. Mary Lauder podcast show. It's so lovely to have you.
Thank you so much, and thank you for having me.
Yes, well, we met at a conference, and just got to, as usual, chat about things. And in doing that, it just certainly made sense to get together and talk more about your specialty, what you do, which is genomics. And as you're in a role as a clinical team leader for DNA Life Lab, which is in two countries, really, isn't it? Denmark and the UK. Is that how you would say that?
No, we're the key descriptor really would be that we are a global company. So we work all over the world. Currently, last count was 117 countries that we have sent testing to.
Okay.
We have two head offices. Our head office is in Denmark, um, and then we have a head office in the UK as well. But then our lab for all our DNA life testing is in Finland.
Okay.
So we are the true meaning of a global company.
And that's wonderful because that globe reaches us here in America, and that's how I found you. And having done genomics really since 2017, there's a variety of companies I've used, and your company has a very good way of approaching not just the testing, but the reporting, which I think is really important because that's the key is being able to communicate what the genomics mean to the patient or to the client. So, in your background is in nutrition. And so you're going to look at things from a functional nutrition, a lifestyle approach, and that's where genomics comes in. And we're going to focus on hormones, but for a couple introductory questions about genomics, what do you think is the biggest misconception that you see when patients bring or are receiving their results? What do you kind of go up against that they're not really understanding correctly?
Right. So firstly, let me say I'm very, very pleased to hear you talking about genomics that way. It is our reporting. We are very much a practitioner-based brand. We are very proud of our testing. We work very, very hard to make it really applicable in a clinical setting for practitioners to optimize for their patients. Um, but the kind of one of the biggest things that I find coming up a lot, that practitioners find coming up a lot, is patients think because it's their genes, that when they have a variance on a gene, that is it. that is done for, they are going to get whatever it is that that gene is involved in. So as an example, looking at some, say, disease diagnostic genetics, that is what we would call a high penetrance gene. So we're looking at a cause and effect of that gene. So with that genetic variance, there is every possibility that will manifest into some form of a disease state or a specific condition. Whereas the kind of genetics that we are looking at here at DNA Life, we really are focusing on the nutrigenomics. So we're looking at low penetrance genes. So the kind of genes that we have, and it's an example I like to use a lot, that there is a diet, lifestyle, or environmental factor involved in whether or not that gene is going to have a negative expression or a health impact. So talking about my favorite, the coffee snip, the caffeine gene. I personally am a fast metabolizer. I drink caffeine like it's water. Um, but some people have a variance in the gene that's involved around caffeine metabolism. That gene is seen with a high impact variance to have a increased cardiovascular risk in someone who drinks a lot of coffee.
Mhm.
If you reduce the amount of caffeine based, so I say coffee, but we're talking anything that's caffeine based.
Mhm.
If you stop drinking the high caffeine load, that cardiovascular risk is reduced.
Mhm.
So that is a longevity based SNP. So we know that the caffeine is the effector in that gene.
Mhm.
Without the caffeine, that high impact variance does not have or does not exert that risk.
Mhm.
And these are the kind of genetics that we are looking at through the DNA Life profiles.
Mhm.
So a lot of, like I go back to my original point, a lot of the clients or patients think that because they have a genetic variance, that's it, they doomed.
Yeah.
And the amount of patients I have saying to me, oh, well, that's it, look at it, I'm doomed. Well, no, you're not.
Right.
Because diet, lifestyle, and environment all play a role in whether that gene is going to negatively express. And the power remains with us to be able to modify diet, lifestyle, and environment to ensure optimal outcomes.
Mhm. Yes, and a good way to put it too would be it's not a mutation.
No,
So it's a variance. It's a
correct.
variance in the expression of the gene. Sometimes I say, how blue is the blue in your eyes? How blonde is the blonde in your hair?
Yeah.
How many freckles do you have? So it's the expression of that gene, which has a continuum. And I always say we get to say, "Thanks, mom, thanks, dad," because half come from mom, half come from dad, and unless we test them, we don't know who. So
No.
we just go, "Thanks, mom, thanks, dad."
It's best not to test mom and dad because that then ends up with familial issues and dramas and infighting.
Exact
Uh, so, but yeah, when you're looking at our reports, you can very clearly see that kind of one is from mom, one is from dad.
Yeah.
But like you say, we can't tell which one.
No, no, but yeah.
But yeah, it's a good point. It is genetic variance, not genetic mutation.
Yeah.
Genetic mutation is what we talk about, that cause and effect.
So let's flip the table then, and what do you wish that every clinician understood about risk versus the destiny of that gene?
I think for me, it would be the understanding that diet, lifestyle, and environment is so, so powerful as a modality when dealing with nutrigenomics. That the biggest changes that can be made are not through giving piles of supplements, although there are reasons for supplements. I'm not saying they're bad and I'm not saying they have no value. I love a supplement. But when it comes to nutrigenomic testing, it really is about managing diet, lifestyle, and environment
Mhm,
um, to really optimize the outcome for that client or that patient.
mhm,
No, it's a longevity thing here. So genes do not change. If you have that high impact variance, so manifesting, practitioners manifesting that diet, lifestyle, environment, those really, positive changes on a day-to-day basis have the best outcome in the long term.
Yeah. That's really good because I think people, and I think of a particular gene if we pick on the ApoE gene. Oh, if I have it, I'm gonna have dementia. Well, not necessarily. We have to look, well, my dad did. Okay, well, what was involved with his lifestyle? What things was he exposed to? Oh, he was a smoker. Oh, he drank a lot. Oh, he worked in metallurgy. He was working in a plant. Well, that's a whole different picture.
Yep.
Uh, and the other thing with the ApoE gene, for example, could be that it could have a cardiovascular variant the generation down versus the dementia variant, depending upon what else came through from the other side, the other gene that joins in. And so we could see a variance of that relative, especially in women, towards cardiovascular disease.
Yeah.
Or the generation above, we might see heart disease, but not dementia. And then in your generation, we see the dementia. And so it's very interesting what I've seen over, the hundreds of tests that I've done with patients is how that all plays out. But it's not a diagnosis,
Yep.
not a destiny sentence. And then what we need to do is take the tests that are influenced by those genes. Whether it's lab tests, imaging testing, functional testing, stool testing, whatever they are, hormonal testing, and bounce those out or see those through what those gene pathways are doing. Would you agree with that?
I'm so glad you say that because it's something that we're quite passionate about is, you know, understanding your genetics and then looking at those functional tests. So looking at, what is currently going on. And we drive this forward quite a lot is that genetics don't change.
Mhm,
But by understanding what is real time, what is currently playing out, is the most powerful tool for the patient as well as the practitioner to truly understand that root cause of optimal health.
mhm,
So, pairing them alongside, we're going to talk about various tests, but looking at the hormone test, you
mhm,
know, pairing that alongside a functional test, you can very actively see where those genes may be playing out, which does give you that much but as I say, much more root cause, but such a powerful tool in your intervention protocol.
mhm. It is. It becomes a safety net versus something that's scary because you see, I think when we've got the genomic part, we literally have the roadmap for health. And it's like, it doesn't scare me. It actually encourages me that puts on I can see those as guardrails.
Yeah,
And then, when we use a test where we're looking at hormones and we're looking at the hormone metabolism and they come through. And so, say a woman is not on hormones and she's menopausal but wants to go on hormones. I 100% always do the test that does hormonal metabolism before I start it.
absolutely.
Has to be done. And then, sometimes because their hormones are so low that it's hard to register and it says may not be exactly reliable because there isn't as much estradiol. And I say, but the pattern is there because the genes are there, that pattern is there. So if you're going to put a lot more hormones in there, you're going to want to know that you're going to want to test sooner rather than later to see what those pathways actually do when you put something down through those pathways that are of volume, right?
Yep, absolutely. And I mean, there's a couple of genes that really do dive into that pathway, um, which is very, very good to know, especially as you say, if you're going to be putting more hormones in, you want to know that client or patient is able to metabolize them safely.
Mhm.
So by having that kind of background and then the real time, you get that much clearer picture of areas that you can preempt,
Yes. Yes.
which
And then reverse too. If you do the first test if they're on hormones, because that's when you start working with the patient and the pathways are I use the word dodgy, which is not a medical term, but that's that's a term. turn in a
It should be. I use it a lot myself.
Okay, that's I'm glad to know that's a universal term.
It
Well,
is
like
well accepted.
and so if that pathway looks dodgy, we can actually reverse it. We can actually backpedal that, to back to health, really. We can restore that. And that's the other thing too that I think we need to know about the genomics because they are responding to that environment. We've just changed the environment by changing the biochemistry and the pressures on that biochemistry to make it express itself in a more favorable way.
Yeah.
Yeah.
I'm in a very, very lucky position that I do tend to, or I do get to see cases where they've maybe perhaps done their DNA hormone, let's say, and they've done their hormone profile. And then I work with the practitioner. They then, do the intervention, and I am able to see the follow up to that.
Yes.
And and a lot of the time it's quite simple changes in that environment that makes the biggest real time outcome.
Yes.
But I'm glad you said something earlier about people being scared of their genes, and it was something that I thought of earlier when we started. 10, 15 years ago, if you brought up genetic testing to someone, they were like, "Absolutely not. They're gonna steal my DNA. I can't have," and people were terrified of it.
Yes.
They also didn't understand that distinction between, as you say, mutation variants and nutrigenomics. Whereas now it's being embraced. People are really understanding the kind of the value of that nutrigenomic profiling as a consumer. So as a patient, people are starting to become more aware that actually, you know, it's a very, very good avenue to go down.
Yes. Now, in America, they've changed in a big hullabaloo. That's another clinical word. Do you use that one?
I don't. And where I come from, it would be a big gedunta, like a
Okay.
big mess.
Okay. Yeah. So there we go. So the hullabaloo or
Yeah.
the vedenta, I like that. Um, about around hormone therapy. And we
Yeah.
had the big study, the Women's Initiative study that held things at bay. It was a bad study. It was a poorly done study. It was an erroneously reported study. And it's a study that I was practicing 3, 4, 5 years before that study came out. And straight through that entire time, so for the last 30 years, I've been doing bioidentical hormones come what may,
Mm.
hell or high water. And I always did the best I could with hormones by paying attention and starting low and going slow. But I always was guessing because
Yeah.
that's what you did. Now we've got hormone panels in DNA. So let's talk about that, about how that has changed and advanced what we know, because we've got this bad test, or rather bad study, that gave us really 20, 30 years of no therapy for women in America. That may have gone to other places in the world as well, but it had a huge impact here. And even our physicians don't even know how to prescribe hormone therapy. But, evolving through that, now we have so much more information to be able to provide care. So talk about a DNA panel for hormones.
So I think we have in the HRT, BHRT sphere really in the last, 10 years really, really moved on. And the wealth of information and the wealth of knowledge has really come to the fore. Um, so like you say, previously it was a bit, adage, like throw something at the wall and hope it sticks. But now with the kind of research understanding that we have now alongside something like the DNA hormone. Now, the DNA hormone, we used to have a much smaller profile. The DNA hormone's probably about a year or two old now, um, which has gone from just understanding a woman's genetics around detox or hormonal detox to now having a complete understanding of the genetics involved in not only detox, but also the hormone production, estrogen, progesterone, testosterone, how the body is managing that, how the body is metabolizing those hormones. And then also those very, very crucial detox and methylation hormones that are so important when we're bringing in that HRT or BHRT sphere to what you touching on what you said earlier about truly understanding that background. So the DNA hormone profile is very special and it's very unique, and I am very, very, very fond of it
Yeah.
because it can increase that understanding right from the point where that cholesterol is converting to pregnenolone, which then goes on to form all of our hormones. So it starts at the very beginning and works genetically through the entire pathway. To get that understanding of at every step of that production pathway, the transport pathway, the metabolism, the excretion, how the client's or patient's body is managing from a genetic perspective. So when you're dealing with HRT or BHRT, I mean, I say that I've always been a BHRT fan. You can get that very clear understanding from that genetic perspective, how they may be managing metabolizing those additional hormones.
Mhm.
Some genes look at if what their hormone response is going to be. So some people may respond better than other people.
Mhm.
Um, so the whole test from start to finish gives you those absolutely key insights. Not only if you're on BHRT, but if you're suffering from any kind of hormonal issue, or you want to
Mhm.
ensure that longevity within your hormonal sphere.
Yeah. I think, and I'm just sitting here, this is just music to my ears because I'm done guessing. I just don't have, and that's what I tell people. I say, I've been doing this, I've been a physician 33 years. I've been in the functional world 30 years. I don't have to guess anymore.
No,
I just don't.
when I first qualified back in the dark ages, it really was. It was a guessing game.
Yeah.
There were some tests available. Genetics, not so much. Although I will admit that my first genetic foray was actually with the company who do our DNA live testing.
Mm,
Well, I mean, they're ours, but
yeah.
back then it was, and they had one test.
Tell me, was it
Whereas,
for the MTHFR, was it? Is that what it was for?
uh, they had two tests. They had what is the DNA health, which
Mhm.
we still have, obviously updated since then.
Mhm.
But it did have MTHFR on it, ironically. Um, but so does our DNA hormone profile,
Yeah.
along with COMT,
Yes.
which the COMT is a gene I absolutely love. It's on well very many along with MTHFR of our DNA profiles.
Yes.
But when we're looking at our hormones in terms of how our body are methylating, those two are absolutely key.
Mhm.
And they do tend to bounce off each other.
Yes, and people
So,
get a little centric on those 2 genes or even just
yeah.
the 1 gene of MTHFR, because I hear all the time, "I have MTHFR and I'm in trouble."
Oh,
Like, "Well, no, you'll die with it, not from it. So let's move along here, nothing to see." And so, I mean, I really do say that now. I said, "No, no." And so nothing is monogenomic, which means 1 gene.
no,
It's gonna be polygenomic. And then what
correct.
we and also because it's um, technically chronic, it's gonna be multifactorial, and that's where the environment comes in. That's the levers on the genes that are making them express a certain way or less so. Um,
Absolutely.
yeah.
MTHFR, I speak to hundreds of people and it's, oh, MTHFR. And it's like, well, no. What do you mean, no? Well, it doesn't work on its own.
Yeah.
There are a couple of different facets of MTHFR we're looking at. We're not looking at just MTHFR on its own. MTHFR, it is part of that folate production, but then comp needs the folate. So the human body is the most miraculous thing. And it's why I went into medicine in the first place.
Yeah.
Um, the human body is just capable of the most incredible things. But you've got to remember that there's so many different levers that are working at the same time.
Yes.
And when it comes to methylation, MTHFR is just one small component of a much bigger picture.
Yes. And so that bigger picture, if we go through the liver, has 3 stages to it. 1, 2, and 3. We call that anything from detoxification, biotransformation, taking out the trash to it doesn't exist. I mean, I literally hear that. There's no no
Really?
yeah. What I hear is, "Well, I will take my hormones topically so they don't go through the liver." I'm like, "Sister, everything goes through the liver."
I'm sorry, the air you breathe goes through the liver.
Yes, exactly. I said, absolutely everything will eventually go through the liver. Now, what they're referring to and why I'm kinda giggling is because there's the first pass, where when we take something by mouth orally, that does hit the liver much faster, much harder. And there are genes on the panel, in the hormonal panel, that will tell you if you take hormones orally, you're at greater risk for blood clots. Great, we need to know that.
Yeah,
Or you have that propensity towards blood clots whether or not you take hormones. And so certain tablets, certain pills, certain other things that come in orally also will have an influence there, not just hormones.
oh, absolutely.
Yeah, so that's important to know. But rest assured, anything you apply topically or that goes through a patch or comes in vaginally or rectally or under the tongue will eventually make its way through the liver.
Absolutely. I mean, that is the liver's primary role in life,
Yes.
is to detox or bioeliminate, or, everything we're taking in. It can be a laugh about, oh no, even the air that you breathe. But if you're taking in pollution, everything you're drinking, everything you're eating, um, you know, but the environment plays a massive role in if it's going to be working effectively. And it's a topic of conversation I have very often when people come to me with GSTN1 variances, GSTT1, NQO1, any of these, and antioxidant variances. These are all variances around these kind of processes. Is that one thing you need to do is to reduce the overall toxic load.
Mhm,
So and it's not just from a hormonal perspective, it's avoiding those processed foods. It's avoiding, I mean, I'm South African. Barbecuing is a national pastime for us,
mhm,
but it's understanding that, there are risks when you're eating grilled, char grilled, blackened food,
mhm.
and it's about understanding those kind of factors and how they may limit the body's ability to successfully detox our hormones because we've increased that load. And the liver is a miraculous beast, but if you keep putting stuff in it that's going to, load it up, it's not going to have the bandwidth to manage our hormones effectively. It's not going to manage, you know, medications properly. It's not going to manage those hormones properly.
Yeah. So, to be sure, when we're talking about detoxification, it is the liver. When we're talking about medication, environmental things, hormones, all of that going through the liver, we have to know those pathways. That's
Absolutely.
and that's what, Virginia, you and I are saying by we don't no longer have to guess, will this work? We no longer have to guess what nutrients do we need to support the pathways. Or when we look at a test result that looks at hormone levels or metabolism, we don't have to say, "Well, I wonder why that's happening," because we know the genes, which is the roadmap. Then we apply the lab tests that give us the information that we're able to steer the patient clear, back them up, improve the health, and avoid the hullabaloo and dodginess that we're trying to avoid.
But what I think it does is it gets us and our clients, patients to the point of health improvement
Yes,
and success faster,
yes.
because we're not dealing with and I remember it so well for, well, this might be the problem, that it might be that. But I'm going to go with my gut and I'm going to address that,
Mhm.
and let's see how we go.
Yeah.
And then 6 months later, you're like, well, not great, not 100% yet. So let's go there and try. Whereas this, it's succinct, it's to the point. It gives you everything you need to know to be able to really optimize. And I mean, I've said optimize and I've talked about longevity a lot, but that is what it's about. It's optimizing the intervention, it's optimizing health.
Mhm. Yes. So, if a person were to start and say, "Gosh, I wanna do hormone therapy, but, I'm a little nervous because when I had my periods, because they could be just let's put them in the menopausal or just postmenopausal, because menopause
Right.
means no periods for 12 months, and usually the follicle stimulating hormone is elevated, and usually estradiol and progesterone are low. So that's usually the criteria, but the 12 months is the key. And so then after that becomes postmenopause technically. So they're there and they wanna do hormone therapy, and they say, "But you know what? When I had my periods, I had headaches, I had PMS." I mean, do you think that that's a pattern to pay attention to when they're postmenopausal? Would that tell you something about the liver?
Absolutely. Because that does speak to a longer term hormonal dysregulation.
Yeah.
So even though they now are postmenopausal, it does not mean that going through that hormonal addition journey doesn't rephrase that. When they start that HRT journey, they need to understand what came before.
Mhm,
They need to have that understanding because once you start to reintroduce and start bringing those levels up, there is that possibility that there may be effects from it because we don't know what went on before.
mhm,
And it does speak to that dysregulation. So
mhm.
getting a key understanding of what they were like while they were still cycling, while they were still having those periods, and what influences the genetics may have can really improve the outcome in terms of that HRT,
Yeah,
in terms of the kind of side effects. Um, but also with having that kind of dysregulation, again, like you say, is there a genetic variance around that elimination
yeah,
that caused that increased level of hormones within their body, which then created that symptomology?
yeah,
And that won't have changed even now that they are no longer cycling. That core genetic variance that maybe have or may have had that impact has not changed. So
correct.
now we're potentially going to bring that BHRT and that HRT back in, and those detox processes and that elimination process may still not be working optimally.
Yeah,
So that is definitely an area you want to get into and focus on before starting that journey to get that real understanding.
yeah. So when I do that with patients, I say sometimes we need to just kinda clear things out, clear the decks, and then see where you are. Because even doing that, sometimes a lot of the menopausal symptoms improve because you've improved the health of the liver, because you've understood the genomic pathways, you've applied nutrition and lifestyle changes to that area, some supplementation where it's needed, and then the liver's in better health and better shape.
Absolutely.
Yeah,
Absolutely.
yeah.
It's but again, it's the power of the nutrigenomic testing is that by improving that overall health and that pathway, irrespective, those kind of diet, lifestyle, environmental changes
Mhm,
can have far reaching effects beyond just that elimination.
mhm.
So a lot of women exactly in this sort of scenario do feel so much better just by making those changes in line with their genetic variances.
Yeah. And I think that that's really important because not always are we meant to give put more or use more to accomplish something. And also when we use bioidentical hormones, we're using them every day of the month, and it's a steady state. We're giving the same dose every day, and that's not what the hormones did before menopause.
No.
And so we're giving it a false state, an artificial state, and we're expecting it to function physiologically without understanding how it's built. So in my mind, it would be make perfect sense to understand the blueprint, the roadmap, and then proceed. Um, you know,
Absolutely.
yeah.
Women, we're cyclical. We're meant to be cyclical.
Mhm.
And when we bring in that additional hormone, as you say, it's a constant state.
Mhm.
We're putting it in. So we're still creating an environment that the female body is not necessarily designed to handle.
Right.
So the more information you have, the more power you have to make that transition well and comfortable.
Yeah. Yep. That's it. That's it. That's exactly it. So,
We're all, we're in this business to help people and make people feel better.
mhm,
And if we have the tools available to us to be able to achieve that, fantastic.
yeah, for sure. What do you say to folks who or what do you think has been maybe the biggest surprise genomically that you've seen since you've been, in the say like the past 5 or 6 years? Maybe something that's done the biggest change or adjustment in health because of genomics, or something that was surprising that you learned that you gosh, I just didn't think it would be that much of an influence. Well,
Um, I'm trying to think. That's a really good question. Um, the first thing that really springs to mind is this is a bit more of a scientific answer,
mhm,
is how the field has grown from, we are very, very serious about our reports. We support every single one of our profiles with very, very robust research. And, 15, 20 years ago, that wealth of information was not there.
yes.
And now, something like the DNA hormone, that is possible because research and people's interest in nutrigenomics has grown so exponentially. That now, every report undergoes reviews regularly. There's always new research. There's always new things that are coming out. Um, and that really, really blows my mind, is that the strength and the robustness of the quality research that is coming out within the field.
Mhm.
Um, in terms of what I have looked at and gone, wow. So you touched on earlier in terms of the oral hormones and the SNPs on the DNA hormone profile. Now, those are factor 2 and factor 5. Now, until quite recently, factor 5 was the only one we reported on. Recently, factor 2 has been brought in as well. For me, I I mean, a staggers is a very strong word, but it blows my mind that we can look at genes like factor 2 and factor 5 and be able to preempt the risk around taking oral hormones, because they do increase that thrombosis risk. And not just that, but also women who fly who have these variances need to be very careful and wear those pressure socks and get up and keep moving on their long-term flights. And I think it's a little bit personal for me, because very early on in my life, I was told, because of, chronic familial hypertension, I was never allowed to take oral contraception. Um, and, it was at the time, I was like, "Oh, whatever." But as I age, having that understanding of factor 2 and factor 5 really, really, for me, is life-changing.
Mhm.
And for a lot of women out there who previously may not have known that they do have a variance or a susceptibility,
Yes.
by doing this DNA hormone profile, they that information is life-changing.
Yes. Yes, and I think that's really good because, the standard of care is you get a blood clot, you're on a anticoagulant for 3 to 6 months. That's somewhat arbitrary, to be honest. They don't always ultrasound your leg to make sure if it's a deep vein thrombosis,
Yeah.
they, don't always ultrasound your leg to make sure the clot has completely cleared. And then they discontinue the medication, and then they say, go with dog, good luck. And, you don't really know. And
No,
so then
and
it's
I don't
based upon the treatment's based upon risk factors and statistics. Where here we've got that extra, it's not even a tiny step, it's an extra huge step saying factor 2,
yeah,
factor 5, you're at greater risk. Here's how to
yeah,
prevent those.
yeah. And I don't know about you, I mean, the thoughts of having a deep vein thrombosis and getting shuffled off after a few months and told, "Well, you know, good luck." I mean, it terrifies me.
Yeah. That's what's
I
said.
I
That's
I'm not
literally what's
easy
said.
I'm not easy to be terrified, but
Yeah.
I mean, that just terrifies me.
Yeah.
Someone like me who travels a lot and spends a lot of time on planes,
Mhm.
so having that knowledge and having that understanding, so it's I mean, it is game changing.
Yeah. It really, really is. And I think too, the other thing that I think is really important is that we can guide women around cancer with the hormone panel. That's game changing. That's life changing.
Absolutely.
Um,
Absolutely.
and I'm gonna, and I'm not talking the BRCA gene. I'm talking understanding the physiology that's going on by understanding the pathways through the liver, how things are metabolized, what environmental pressures are there, what emotional stress and living in fight or flight can do to your genes, how that disrupts the microbiome, because the stress level affects microbiome, which affects the communication of the microbiome to the liver, to the
Yeah.
gene. And some people have more of a push from their gut to the genes than the genes to the gut, because that's how their genes are expressing. That's the
Yeah.
level of their expression. And so when we put some of these tests together, we get to literally see what part of the body takes the lead. And it's
Mm.
to me, that has been one of the most fascinating things. I look at this and I go, those genes are really robust. Those are just really steady. And then you see this part of the gut that is what we would put in the dodgy category. And it's
Yeah.
just like, oh, that's our entrance point to restoring the health. And to
Mm.
me, having done this for 3 decades, to be able to dial it in that specific, I just I just can't wait to get up the next day to do that again, you know? It's just so exciting.
But that's why you'll very often hear us talking about the estrogen.
Mhm.
Don't forget about the gut.
Yes.
It's part and parcel with hormones and women's health and men's health. Focusing on the gut and understanding, like you say, well, it can be perfectly fine, but then you have that one little marker on the hormone profile that makes you go, hmm, let's have a look at what's going on in the gut. And
Yes.
then you find the source.
Mhm.
But also, I mean, I talk about a lot with people when I'm looking at profiles and they're like, I don't understand what the problem is. What's their gut like? What do you mean, what's their gut like? Well, what is their gut like? Oh, no, they're constipated. Okay. So could that be why? Possibly.
Yes. The woman who hangs on to everything,
Yeah.
I
Everything.
mean,
Nothing,
that's
nothing
yeah,
is getting through.
yeah, and that is the metaphor for lots of things in their life.
Yeah.
And
Absolutely.
yeah, and so when you learn to let go, literally, so much of your
And figuratively.
yes, exactly, exactly,
Yeah.
exactly. So, um, what do you think, um, what do you think's on the frontiers for genomics and nutrigenomics? What do you think, I mean, the number one killer is heart disease.
Yes. Um, we as a company are always investigating other options. We are always looking at where the research is and what is coming out.
Yeah.
So there is always a possibility. So as you say, cardiovascular, um, you know, we do a couple of profiles, where you could get a certain amount of kind of cardiovascular risk. But it really is determined by the research, though what the research is saying, where the research is going. Like I said, we are very much about the research, and it has to be really robust. So it does take us a good while to collate it all.
Yeah.
But you never know. As a company, we're always investigating, and we're always looking at what's out there and where trends seem to be going. So you never know.
Yes.
Could it be cardiovascular? Could it be the DNA gut is our newest profile. So that was only quite recently launched.
Mhm.
And again, 10 years ago, that research was not there,
That's
looking at the
correct.
genetics around gastrointestinal health.
Yeah. And
So
and that's such a big important thing too, because I have lost count how many people have lymphocytic colitis, microscopic colitis, and they're also told, see you later, come back in 5, 7, I don't know, 3, 5, 7 years, kind of an arbitrary, maybe that's a prime number. I don't know. I'd have to check my math. And it's like, but they still have symptoms. Things still
yeah,
quite right. But that influence of the gut there and the genes there can send messages across the entire health spectrum of that person's body.
absolutely. And, we have spoken that, these are not disease diagnostic genes, but they all in their own way, in some way, play a role in that kind of pathology. And the sad thing about colitis is, as you say, it is very much we were going to wait for the wheels to truly fall off before we will even consider. Whereas, by understanding your genes, you can go so far towards bringing that into a more manageable state.
Mhm.
Um, there's things there like MAGI2, which looks at, I mean, it is the tight junction, but you think from a functional perspective, you've got tight junction issues, you've got that inflammation, you've got all that, genetic stuff playing out in the gastrointestinal tract, which is contributing towards that symptomology.
Mhm. Yeah. Yeah. It's exactly right, and that would be so when people say, "I wanna get to the root cause," there it is. That's the
Mm.
root cause. And so,
Yeah.
again, diagnostic from a functional standpoint, how is the gut functioning? There's always structure, there's always function, always. And those are interrelated, and those are closely, cohabitating, and that gives you the anatomy and the physiology, and that gives you really the human condition from a clinical standpoint. And then we put together that with, the nerves. So what, 500, oh, I think it's 500 million nerves that go from the gut outwards, from the gut-associated lymphoid tissue. It's just an enormous amount. And the microbiome itself is trillions of cells, 1.3 times the cells of the human body, which is in the tube that goes through you, but it's outside of you, which I love to tell people. And they're like, "What?" I go, "Exactly. It goes through you, but it's outside of you." And so have fun with that one, folks. And so that's the most, that's a barrier to the outside world. So
Mm,
is the microbiome really going to be that influential on your genes? The answer to that is simply yes, on all
mm,
account. Yeah.
mm. But also, we know the microbiome plays a role in, our gut brain axis, which has, you know, always been big news, but seems to be getting a lot more interest now, is that understanding that not only is the gut involved in hormone and hormone metabolism and hormone excretion, but also is an absolutely pivotal role in our brain health
Yes.
and our neurotransmitter health and how we are managing our day to day. Um, you know, there isn't one part of the human body, I feel, that the microbiome does not have a role in.
Yes.
It is so, so, so important. So important. And so many of those genes on the DNA gut, a variance can really impact how your microbiome is handling life.
I mean, the microbiome is in the mouth, the microbiome's in every area that has the bladder has its own
Yeah,
biome. Joints have their own biome, fascia has its own I mean, it's just we're just
it's huge.
like a bag of bones carrying around a biome, really.
Yeah. The amount of clients or patients that I talk to and I go, "So how's your mouth?"
Mhm.
"What now?" How is your mouth? When last did you go to the dentist? How many times do you brush your teeth? How are your teeth feeling? Are they sore? Do you have gums bleed? They look at me like I'm an absolute lunatic.
Mhm.
But all I'm trying to understand is that oral health, oral microbiome, and how that, I think a lot of people forget that that's the start of all of it.
Yes.
The mouth is the start of all of it.
Yes. That's very, very true. So the frontier sounds big. The evidence is there.
It's
Where
huge, but
Yeah.
it's exciting.
Yeah, it really is. This is a great time and for me, this is a great time to do medicine. It's a great time to be out of all away from all the systems that I ever was in because I can just really practice with the patients and really go with the clinical science and go with really what's been restorative for patients.
Mm.
And we've been working in some 6-month, junctions and really, really getting back wonderful health results for folks, restoring and reviving and even getting them into whether or not they choose to do bioidentical hormones or not, really at midlife, getting a lot of people sorted out. And,
I love that word you use, restorative.
mhm,
That it really, really resonates with what we do as practitioners in this sphere.
yeah,
Because it is, it's restorative. I love that.
yeah. Well, the body has the inherent capacity to heal. We just gotta
It
figure
does.
figure out how to work with it and work
Yeah.
with its wisdom, and then, otherwise, just dress it nicely and in fun ways, and
Love the
keep mo
color.
Yep, and then keep moving, right? Keep moving, movement is
Yeah.
life. So,
Yeah, it's if you're not moving, you're stagnating.
that's right. Well, it's been a wonderful conversation, Virginia, and I'm so glad that you've taken your time. You're a few hours ahead of us, so I know the rest of the day is gonna be great because you've already been there, so that's really
True.
fun. I always like that. And I thank you for coming, to our podcast today to be our guest and really explain to us the importance of this test. I'm gonna put notes in the, or information in our program notes, how to get this DNA testing. This is not a one-hour commercial for the company. This is important information that transforms your life. Therefore, I'm taking this time to highlight what I think is the best company around and to highlight why I think this testing, this research, and this approach to your health can literally transform and reform how you live your life and get and really can restore your health if no matter what stage that you're at. So this is a really, really important podcast, and I'll promise you, folks, it's not a commercial. I'll tell you when
No,
the commercials.
can I just say, yeah, can I just say one thing? So just touching on what you said. Yes, I work for a company. They are our DNA tests. I am very proud of them. But I was a practitioner before I started working with the company. Still am a practitioner. And I firmly, firmly believe that every single person should understand their genetics and do these tests
Mhm.
because it's now not just oh, it would be nice to have. It is a absolute imperative that you understand your base building blocks, what is going on with you at absolute bare level.
Yes.
So I'm biased, sure, but the unbiased one of me would still say exactly the same thing.
Yeah. Well, I appreciate that. Biased or unbiased, we'll take that, and we'll take you as an expert in this field. So thank you very much for sharing your expertise with us today. And folks, we'll see you next time on the Dr. Mary Lauder podcast show. Thank you for being with us today.
Thank you so much for having me.
That's a wrap for this episode of the Dr. Mary Lauder podcast show. I hope you've heard something today that made you think, laugh, or say, well, now that was a plot twist I didn't expect. Just remember, your health journey is more than lab results and supplements. It's spirit, soul, and story, and sometimes a gadget or two you probably should have returned. If you enjoyed the show, please rate and review us wherever you listen to your podcasts. And please share our podcast with someone you love. If you didn't like the show, well, maybe don't tell anybody then. And if you want more soulful medicine, curious conversations, and tools that actually help, visit me anytime at drmarylauder.com. Until next time, stay kind and stay curious. Music today is provided by Mr. Dave Evans. He composed, played, and engineered this song specifically for our podcast, and it's called Soul Strings, an acoustic reflection of the healing path. Thanks, Dave. It's great music.